Welcome back from that short break, and thank you for tuning in. Now we head into our expert discussion where we go beyond the symptoms to help you understand your body, your health, and how best can you improve your overall well-being. Now, in our previous discussion, we introduced a concept of total pain and learned that pain is not purely physical. It's a person's emotion and social plus even spiritual experiences that influence how pain is felt and managed. So today, from that discussion, we come into part 2, and this time we are going to be deeper in the classification of pain. And is all pain the same? Is it the pain from the fresh injury as the pain we know, or that has lasted for months? Why does one person describe pain as aching? So today, to guide us better into this discussion, we have still been joined by our specialist, and this is Dr. William Kamya with GMB, public health specialist, palliative care specialist, and medical educationist, and the director of Educav Health Institution. Now, today we are going to explore part 2 of this type of pain so that you can understand more about it. You're most welcome, Doctor.
Thank you so much.
Thank you for coming once again.
Amen.
At TV1.
Okay.
Yeah. Okay, so Doctor, for some of our viewers who missed our previous episode, briefly introduced to them what is exactly this total pain.
Thank you so much for the opportunity, and our viewers, a good afternoon. Thank you for following us. We are passionate about empowering you as the viewer, because actually in care, the patient is at the center of care.
Yeah,
then we have the family around this patient, and it's from the family that we see people who are going to offer direct care. They even carry this patient to the hospital. Then the health workers join the caregiving team.
Okay.
If the health workers knows what to do well,
Yeah, sure.
and the caregivers don't know, we mess up the
Of course,
patient.
yeah.
If the patient doesn't know and they can't even explain well, the health worker will not make the right diagnosis because they can't explain explicitly well. So we come to say, empower the owner of health. This is the client, the patient. And we must understand this concept of pain in its totality, because it's the major symptom that causes people to either take you to hospital or you move yourself there.
Okay.
And we discovered that pain can be resulting from either physical or emotional unpleasant experiences that are resulting from actual tissue damage or potential tissue damage. And the patient is the only source of information about this pain, this symptom, to everyone around this patient. And this program therefore empowers you to be able to understand your situation and cause others to understand it to help you better.
Yeah, sure.
Great.
Okay, so Doctor, today we are talking about the classification of pain.
Yes, sure.
Why is it important to classify this pain of simply just saying the patient is in pain?
In a situation where we are in Uganda and many developing countries, where every single health worker has to attend to multitude of patients with different conditions. On average, a client, a health worker will spend about, let's say, 15 to 20 minutes seeing this client so that he can be able to cover the huge lines. Meaning that during that little interaction, the health worker must have known how the patient really feels,
Okay.
so that he's able to treat them.
Okay.
And if the patient misses out an aspect, for example, talking about types of pain,
Okay.
we have acute,
Okay.
that which has a sudden onset, and you describe it as chronic.
Okay.
The causes of the pain that stays longer for weeks
Yeah.
are different from those that are causing sudden onset of pain.
Okay.
If the client is not aware that I must tell my caregiver that this pain has been existing for more than a week, then the diagnosis can be messed up.
Yeah.
Or if he says this pain is not the only pain, but I have this one which has occurred suddenly, but I also have the other one which has stayed longer
Okay.
in his own or her own body.
Yeah.
Therefore, when the patient masters her pain and knows the types, it can be great.
Okay.
Yes.
So, Doctor, you've talked about acute pain. At what point does this pain stops being considered acute and becomes like chronic?
Now,
Or is it purely about the number of weeks or months?
it's about time. It's about time.
Okay.
And we always say, if the pain has started on in the past probably 72 hours, that is sudden. It
Okay.
has just started.
Yeah.
But if it has been with you, sometimes you've even treated it and it has not gone, or it goes, but it comes back.
Yeah.
This recurring pain is not necessarily new,
Okay.
because it might be the same condition causing you that pain. Therefore, you must report that this pain here,
Yeah.
the leg has been paining and I have always been relieved when I take this medication, but once I'm off the medication, this pain reoccurs.
Okay.
Meaning that it is existing for a long time and the causes are quite unique. Yes.
Okay, doctor, on that same note, we often hear people say you have healed. So why are you still in pain? Can pain continue even after the original injury is healed?
Great.
And why?
True. And that's why the concept of total pain comes in.
Okay.
If you treat my physical pain, for example, if a patient had cancer of the leg,
Yeah.
and the decision to cut off the leg, amputation, you know, when you say cut off, it has a way it feels horrible.
Okay.
But we are saying maybe they've removed your leg to save the rest of the body from the spread of the cancer.
Okay.
The pain that was resulting from the cancer itself eating up the tissues in the leg can be ended when the part of the leg has been taken off.
Yeah.
However, there is what we call, there is a pain that comes when you imagine in your mind that my leg is still there and you are trying to move even the leg. We call that phantom foot syndrome.
Okay.
It's painful. A person experiences pain simply because the mind was not cut off.
Okay.
Therefore, the pain that has been caused by the disease itself, when you get cure from the disease,
Yes.
can disappear.
Okay.
But the pain that is associated with the effects that disease has left in you, in your body, can persist. But when they persist, they should also be treated. And that's why we have reviews. You come back, you are reviewed, and that pain is. Then there is pain that can occur because of any other, not associated with the disease itself.
Okay.
A person was having a cancer in the right leg, then falls and sustains an injury in the rib.
Okay.
Those are two pains
Yeah.
caused in a different way. And when our client is explaining the experience of pain,
yeah.
must distinguish these two
Okay.
and be able to share precisely that there is this pain and this is the way it's behaving, and there is the other pain.
Okay.
Yes.
Are there any other ways we can classify this pain apart from that we have seen?
Sure. Some when you are acute and chronic, or long term and sudden onset, but there's also another which is associated with the cause.
Okay.
Although medical people can understand this better, but I want our viewer to be empowered to some extent to understand that pain can be caused by actual tissue damage.
Okay.
There is pain you will receive because your nervous system, which is intact, not damaged, is actually helping you to perceive. And this is if you cut yourself, if you hit yourself, if something traumatizes you on the body, you will feel that.
Okay.
That is what we call in the medical language nociceptive pain.
Okay.
However, there is another type of pain that can come as a result of malfunctioning of the nerves.
Okay.
This is common, especially in older people, or people who have suffered from diseases like diabetes, hypertension.
Okay.
When the nerves lose a bit of their lining, or they've been overpressed, maybe following an accident, the healing, the scar presses them, compromises blood supply to them. They start making you experience a pain. That one we call neuropathic, because the nerves, neuropathic, diseased. The nerves are the ones now causing you to feel that. And that pain is usually explained as pins and needles, burning, those kind of things, burning in the feet. And the person's like, it's like fire inside my feet.
On that same note, why is it that the pain that is on top, like let me say for example the one leg injury, and the one inside the pain from the internal organs may be hard or difficult to like pinpoint at something than that one or that is often on top?
Great. Very good question, because the pain usually on the tissues that are around the body, you can even point with your finger and say the pain is right
there.
Here. But for organs inside, the pain is usually difficult to describe. Because you may not even you may not be able to locate with your finger. It might be moving from one part to the other. The pain of internal organs, because of the nerves that pass into the spinal cord, and sometimes they pass adjacent to each other. Some pain of the internal organs is felt as if it is coming from some place. We call that referred pain. And patients usually have challenges. I'll tell you one. People who usually have peptic ulcer disease, they usually experience a pain that seems to be coming from the back. But when you examine the back, it will be perfectly well. The issue is this pain has been referred. Sometimes people say the pain is moving, it starts from here because those internal organs move. Or you can be experiencing the pain on one side, and when you touch that side, the other side also feels pain.
That pain.
The issue is, when you are explaining your pain to the medical worker, will be able to associate and link all these facts to make a good diagnosis. Because if you misdiagnose pain, it will not go. Yet freedom from pain is a fundamental human right. In fact, that's why I am here to remind you, my viewer, that you have a right to be free from pain. And that's why everyone is doing their best to ensure you can be assessed. But for you to be assessed well, tell the story well.
Okay, so doctor, can a person experience this severe pain in an area where they have lost or lost normal sensation?
Sure.
Okay.
And that's how the neuropathic pain happens. They will experience, the nerves will start perceiving and transmitting impulses that are not realistically there at all. That is pain associated with potential injury.
Yeah.
Even when you sit for long in a given position, you can start experiencing some pain in the leg, loss of sensation, then pins and needles. But when you release the pressure at that nerve, you are able to recover.
Oh, very well.
Now, among people whose nutrition is not okay, the age has caught up with them, diabetes, cigarette smoking, cancer, anything that can damage potentially nerves, including old age, because they get demyelinated, the myelin sheath, the lining of the nerves gets, it actually diminishes. That means their sensation becomes gradually abnormal.
Okay.
Yes.
Okay, so doctor, there are any causes that brings about these categories of pain?
Yes, as I said, pain due to actual damage.
Okay.
Damage can be due to trauma, for example, a hit, you are cut. Damage can be due to a disease, the disease causing organisms, damaging the tissues, and causing swelling, inflammation, which you call inflammation. Whenever there is swelling, because when body cells are attacked, they also fight back. We have defense cells. But once that war is there, the body tissues usually get damaged. And that's how we even end up developing swellings and pus
coming out.
But once that happens, the pain sensing tissues, the nerves, will perceive that pain and alert you that there is a problem here. And that's why if we don't want to ensure, we don't want a lot of damage to happen, we reduce the speed at which the swelling is happening, reduce the number of microorganisms affecting, and cause calm and healing to such places.
Okay, doctor. Here is a question: can a patient genuinely be in severe pain when scans and X-rays or laboratory tests do not show any obvious case?
Very true. Very true. And that's why we are particularly careful about awareness of things that can make pain worse. If a person has damage somewhere, not every damage will be seen by the scan. Not every damage will be seen by the X-ray.
Of course.
I want to tell you that if a nerve has been overpressed and the blood supply to that part of the nerve has been compromised, it will start sensing danger and will send a signal of pain. Now, if you go to the X-ray, normal.
There is nothing.
Blood, whole blood, everything normal. But the issue is, in your history, you sat for 2 days in a bus coming from West Africa to Uganda. That's why the patient must be able to explain to the doctor, yes, all other investigations are negative. But the fact is, I traveled. I did not sleep. Now, if the person has lost a dear one, pain can be there.
Yes.
And actually aggravated or made worse because of their emotional state. But we shouldn't forget that sometimes, I talked about phantom leg, phantom foot syndrome. If a person has ever experienced a severe injury, the brain keeps a memory of that. And sometimes people can experience pain as if it is occurring as it was, but it is logically generated and manifested as pain. That's why in some cases the medical worker must examine a little more, go into the social aspect, examine the psychological aspects, examine the physical, go into the spiritual, go in, you know. I will tell you that mothers will tell you that if they hear any bad news about their child, the labor pain seem to be returning. Such can occur, and it can be vividly expressed as pain. If you are not particularly if you don't pay attention, you actually mess up. You give them painkillers. I'll tell you that some painkillers actually do not work on, for example, neuropathic pain. Not every painkiller will work. You give your Panadol, you give your Brufen, you give your diclofenac, Piloxicam, all those are painkillers. You are not going to do anything on this neuropathic pain. The best is to ensure that we identify the pain and be able to name it, classify it well, and administer the management plan. Beyond physical, paying attention to emotional. Yes.
So why do you think some health workers and family members sometimes underestimate a patient's pain because like the patient does not look sick?
Actually, we are talking about the pain between the health work, between the family members and the patient themselves. You'll be surprised to know that when pain exists in a family member, yes, the family member feeling that pain has pain, but even the other family members who are taking care of her have pain. I'll tell you that the patient will tell them at 8 a.m. the pain in the leg is so severe and is crying. Everyone leaves knowing the person is in pain, and they stay with that. And the patient will not tell them that now the pain has gone down. The family members will continue feeling the pain of having a loved one in pain. Now, it must be known that the patient should be updating, helping the caregivers to be relieved of their social psychological distress and pain as a result of not being sure that they are improving. Therefore, the suffering of the patient might be misunderstood because some people actually exaggerate pain. They might exaggerate pain, even in the way they report it. And it happens usually among adolescents. Yes. Then others might be seeking for favors and what. However, sometimes, because of the emotional instability and circumstances surrounding the patient who is experiencing pain, can have pain perceived severe, more severe than the actual pain, because they are distressed. Therefore, when a person says the tooth is paining and is crying and running around, people might mistake it. But let me tell you, the tooth pain, toothache, can occur in one tooth, but you feel like the whole jaw is painful and every teeth is actually painful. So the person can say, how can it happen? But we need to be comfortable to believe what the patient says hurts. If they say the whole jaw is painful, believe it, because it is the truth. And for those who have experienced toothache, know that the whole jaw can pain. Yes, but if you have not, then you know that one tooth is the one having a hole, a cavity. You are saying, how can you say the whole jaw? The truth of the matter is, pain presents in different people differently. And we must believe what they tell us.
Okay, so doctor, can two people with the exact same injury experience completely different levels of pain?
Very true.
And what explains that difference?
Pain is unique.
Okay.
And pain, for example, can worsen in an individual. The perception of pain, we score pain. We will not go through that today. But a person can tell you they have the same condition, but one is reporting very severe and indeed is... Such things can happen when there is inherent fear. This disease condition is going to kill me. Such a person will experience pain to death and will tell everyone the disease, the pain is killing me. Now, if the pain is killing, then it is so severe. But when this person discovers that the pain is not of death, he was suspecting cancer in the abdomen, and they tell this person, no, it was just constipation. Oh my God. Then he says, hey, the pain is now less, it's not even there. So the actual pain was resulting from the fear that this might be a cancer.
Okay.
And that's why clarity of the diagnosis, clarity of diagnosis is naming the disease. Clarity of the prognosis. Prognosis is sharing with the patient what could be the potential outcomes of this condition. Can actually reduce their pain perception.
Okay.
Therefore, when the caregivers at home are speaking to even visitors, the way they speak, when the patient is hearing, when they speak in a way that this disease, we fear it might cause death, they are actually prompting the severity of the disease condition rather than helping the patient to actually recover.
On that same note, when a patient reportedly asks for stronger pain medication, how do health professionals distinguish uncontrolled pain from drug dependency or misuse without unfairly judging the patient?
Very good. And that's why when we are, for example, training healthcare providers, they must be now trained differently.
Okay.
Because apparently we are living in a season where our health systems have improved, are improving. People will live longer than it was before.
Yeah.
That means we are going to have chronic disease, chronic illnesses, and people are going to experience more pain than it has been before. That means we must be able to dedicate ourselves to the understanding of the pain. Like I told you, if you explore the social, psychological issues of this patient, spiritual issues, you reduce the perception of pain significantly.
Okay.
By the time you reach the actual physical cause, you are giving a modest painkiller to clear. I told you, the one who says, I have pain here, I fear it might be cancer. When the health worker refers them to the Cancer Institute for investigation, by the time they reach Cancer Institute, they are dying.
Dead.
When at the Cancer Institute, they've not treated, but they are assessing and they are saying, oh, this is constipation. The person says, what? Constipation. Okay. A sigh of relief, and the pain is disappearing.
Okay.
Meaning that if you are treating this patient back then when you are referring to Cancer Institute, you would have given a very strong a very strong painkiller. Okay. But if you were able to diagnose well, explain well, many health workers do not take time. Some say they don't have the time. But if you don't have the time to treat well, are you having the little time to mismanage patients? I usually ask that. And that's the very reason why I ended up entering into medical education and to go in to prepare people who can partner with patients and caregivers to improve the quality of life. Therefore, when we see people demanding for stronger painkillers, it is an indication of a failed pain management system. Because the painkiller you are giving is not going to do away with the spiritual pain,
it's not.
the psychological pain, the depression, the diagnosis. even some patients are communicated to. I remember there was a scenario where a patient cried and we were saying, how has the patient now gotten very severe pain? The health worker who was trying to learn Luganda wanted to communicate that you will be healing slowly. Now he ended up saying, you are going to die slowly.
Oh my God.
That worsened the situation. The situation. Appetite went.
Okay.
We blame the disease condition, but the appetite has gone because of the state. Therefore, you can see that we, much as the health workers have a role, the caregivers at home, family level, have a role.
Yeah, very big role.
The patient himself or herself has a role. And when all of us play the good role out of awareness, not ignorance, then we can improve the quality of life.
Okay, so
and
doctor,
live. Yes.
While winding up on that same note, when a patient visits a health facility because of pain, what information do you think they should give to the health worker to help identify that type of pain? And on that same note, I think you should also talk about what mistake Ugandans make when assessing and managing this type of pain, as we prepare part 3 coming in for more discussions about pain. Yeah.
Now, the greatest mistake the patient can do is to say, doctor, you are asking me a lot of questions.
Okay.
I'm sick. Just know I'm sick. You've messed up.
Okay.
Because the doctor is not going to go into your body, feel the way you feel, and then come out with the diagnosis.
Yeah.
When it comes to the family level, family members, caregivers, when you start getting a story around this pain to say so and so might have bewitched you, we don't believe you can even survive. There is a person who has ever experienced that pain and he died in 2 days. You already was messing up
Everything.
because the patient is already struggling with the reality of the disease and imagining what will actually result from the disease. Therefore, whatever you say will either help them build up, and by the time, if you have such discussions, by the time you reach the hospital, the patient will say, I'm dying. And some of them say, I will no longer eat food because they are dying anyway.
Yeah.
I will no longer, I don't want to see anyone here because they are dying. It has been worsened by the caregivers themselves.
Yeah,
Now, when we come to the technical medical workers, failure to recognize pain in a patient who has pain in all its forms is messing up the care.
Yeah.
We must dedicate time. We are not saying that you are going to assess the whole pain, total pain in one session. No. Control the emergency.
Okay.
Continuously assess this patient. Cooperate, work with this patient as a partner.
Okay.
Because he's at the center of your care. And actually, if you are to say we offer quality care, it is the patients to say quality care.
Yeah.
That is it.
That's not supposed to be.
Now, when it comes to the policymakers, leaders in this country, if we fail to avail policies that allow pain management in its totality to take root, medications and supplies that help the country, help the health workers manage pain, if we fail on those, we have failed the pain management system.
Yeah, sure.
But if all of us do our part, report pain early, recognize you have pain, understand your pain well, explain it well to those who are around you, including the health worker, a good diagnosis will be made to know whether this pain is acute or chronic.
Okay.
Or whether this pain is from actual tissue damage or nerves are the ones misinterpreting the situation, and then you will be treated and managed appropriately.
Okay.
Yes.
Okay, thank you very much, Doctor.
Welcome.
So that brings us to the end of today's discussion. As we are winding up, Doctor, for those who missed taking your phone contact last time, we've been receiving questions of people wanting to understand more about this pain. So if you could share your contact and then send greetings to one or two people that are watching you today.
Great. Thank you so much. Viewers, I want to say it's great that you are taking charge of your own health, understand it better. If you need more information, you can reach me on 0772 650 613. I will repeat, 0772 650 613. And that is also on WhatsApp. If you are on Airtel, it is 0703 96 94 09. 0703 96 94 09.
Okay.
And we can be able to interact more. Or you can reach us at Educap Health Sciences Institute, Mukono, just 2 kilometers on Mukono Kayunga Road.
Okay.
We are available to support.
Okay. The greetings, you didn't send greetings.
Greetings, I want to share my greetings to the people who are viewing us and following us, because this is your health. Maybe not many people will tell you what I tell you, but I believe in empowering you so that you can take charge of your health. Thank you for being part of this program. I want to send my greetings to the family, the Nsobuga family, Diabe family, the friends around, Najana Nkumbi Ndeje. Let me send greetings to Elder Gumisiriza. I want to send greetings to the Educap family, the students and our parents, and East Buganda Field and Uganda Union as a whole.
Okay.
The efforts towards improving the health of our people now is in your hand, is in my hand. Let's do our part.
Okay.
God bless you.
Okay. Thank you very much. A special thanks to our guest for today, Dr. William Kamya, for sharing this his expertise with us. Until next time, take care of yourself, seek professional help, and if pain persists, and remember, your health matters. This has been your health show here on TV1. Let's meet again tomorrow. Have a blessed day.